Hello, seniors. I am Dr. Sharon Malone. A few years ago, a woman in her early 70s sat across from me in my office. Sharp mind, independent, still driving herself, still cooking, still proud of the life she'd built, but she looked exhausted in a way I see far too often. Her blood pressure was climbing, her blood sugar was creeping up. Not dramatically, quietly, slowly. The kind of changes that don't set off alarms until one day they suddenly do. She leaned forward and said, "Doctor, I'm doing everything they told me. I walk every morning. I eat less sugar. I take my medications. So why does it feel like my body is working against me?" And I remember thinking, it's not your body that's failing you. It's what your body is missing. You see, as we age, the conversation around health becomes very loud about what to avoid. Avoid sugar, avoid salt, avoid fat, avoid carbs, avoid stress. But almost no one talks about what quietly disappears from the body over time. Not because you did something wrong, but because aging changes absorption, hormones, kidneys, gut function, and how cells respond to nutrients. Today, I want to talk to you about something I wish every senior understood sooner. 4 minerals. Ordinary, unexciting, not trendy, not expensive. But when they slowly fall out of balance, they can quietly push blood sugar higher, and blood pressure right along with it. And the most dangerous part? You often don't feel it happening. Let me be very clear. This is not about blame. This is not about supplements being magic. This is about understanding the physiology of an aging body and giving it what it needs to function the way it was designed to. The first mineral I want to talk about is magnesium. Magnesium is involved in over 300 reactions in your body. That's not a marketing number. That's biochemistry. It helps your muscles relax, your blood vessels widen, your nerves communicate properly, and your cells respond to insulin. As we get older, magnesium levels drop for several reasons. We absorb less from food. Many common medications increase magnesium loss through urine. Stress depletes it faster, and blood sugar itself pulls magnesium out of the cells. What I see clinically is this. Low magnesium makes blood vessels tighter, stiffer, more reactive. Blood pressure creeps up. At the same time, insulin doesn't work as well, so sugar stays in the bloodstream instead of entering the cells where it belongs. People often tell me, "But doctor, I don't feel deficient." And that's exactly the problem. Magnesium deficiency doesn't announce itself loudly. It whispers, through poor sleep, through muscle tightness, through fatigue, through numbers on a lab report that slowly worsen. The second mineral is potassium. Potassium is essential for heart rhythm, nerve signaling, and fluid balance. But it's also one of the most powerful natural blood pressure regulators we have. It works in opposition to sodium, not by eliminating salt completely, but by helping the body manage it. Here's what happens with age. Appetite changes. Diets become more restricted. Fear of certain foods sets in. Fruits and vegetables get reduced just to be safe. At the same time, medications for blood pressure and fluid retention often increase potassium loss. When potassium drops, blood vessels constrict more easily. The heart works harder. Blood pressure rises, and insulin sensitivity worsens because potassium plays a role in how the pancreas releases insulin. I often see seniors who have done everything right, but unknowingly cut out potassium-rich foods for years. No one told them that balance matters more than restriction. The third mineral is chromium. Chromium doesn't get much attention, but it plays a quiet and critical role in blood sugar control. It helps insulin do its job. Think of insulin as a key, and chromium as the oil that helps that key turn smoothly in the lock. With age, chromium levels decline. Refined foods contain very little of it. Stress increases loss. And when chromium is low, insulin has to work harder and harder to get glucose into cells. The result? Higher fasting blood sugar, higher post-meal spikes, and eventually, insulin resistance. This is one of the reasons some people develop blood sugar issues even though they don't eat that much sugar. It's not just what you eat, it's how well your cells can respond. The fourth mineral is zinc. Zinc is essential for immune health, wound healing, hormone signaling, and yes, blood sugar regulation. It plays a role in insulin production and storage inside the pancreas. As we age, zinc absorption drops. Taste changes lead people to eat less protein, which is a major zinc source. Certain medications interfere with zinc balance. Over time, low zinc can impair insulin release and increase inflammation, both of which worsen blood sugar and blood pressure. What breaks my heart is how often I see these deficiencies treated as separate problems. One doctor focuses on blood pressure, another focuses on blood sugar, another adds another pill. Rarely does anyone step back and say, what is the body missing that it needs to regulate itself? Now, let me pause here and say something important. Minerals are not medications. They are not quick fixes. They don't override lifestyle, sleep, movement, or genetics. But without them, the body cannot respond properly to anything else you're doing. You can walk every day. You can eat less sugar. You can take your prescriptions exactly as directed. But if your cells are depleted of the minerals they require to function, the system struggles. This is why I always tell my patients, aging is not just about avoiding bad things. It's about restoring what time quietly takes away. And here's the hopeful part. When these mineral imbalances are identified and addressed, through diet, through careful supplementation when appropriate, through medication review, the body often responds better than people expect. Blood pressure becomes more stable. Blood sugar readings improve. Energy returns. Sleep improves. And people stop feeling like their body is betraying them. I've seen it happen too many times to ignore. So if you're listening to this and thinking, this sounds like me, please understand this is not a diagnosis. It's an invitation to ask better questions, to look beyond surface-level advice, to have a deeper conversation with your healthcare provider about what your body might be lacking, not just what it should avoid. Because aging does not mean inevitable decline. It means your body needs different support than it did at 40 or 50. And when you give it that support, it often thanks you in quiet, steady ways, through calmer numbers, steadier energy, and a sense that you're finally working with your body again, not fighting it. That is what real prevention looks like. Now, let me go a little deeper, because this is where most conversations about aging and health stop too soon. One of the biggest misunderstandings I see in seniors is the idea that if something were truly wrong, you would feel it clearly. Pain, dizziness, some dramatic warning sign. But blood sugar and blood pressure rarely work that way. They rise silently, patiently, year after year, until one day you're told, you have diabetes, or you need another blood pressure medication. And people often feel blindsided. They say, but I felt fine. I believe we need to stop equating feeling okay with nothing is happening. The body is incredibly good at compensating. It will tighten blood vessels. It will push out more insulin. It will work overtime behind the scenes. But compensation is not health. It's a temporary solution that eventually wears the system down. This is where mineral depletion becomes so dangerous. Because the body doesn't collapse when minerals run low, it adapts. And adaptation hides the problem. I want you to imagine your body like an old but well-built home. The walls still stand, the lights still turn on. But slowly, quietly, the wiring begins to fray. The plumbing loses pressure. Nothing breaks all at once. Until suddenly, one day, something fails, and everyone acts surprised. That's what happens when magnesium, potassium, chromium, and zinc are missing for years. Another thing I want seniors to understand is that lab normal does not always mean optimal. Many blood tests only flag severe deficiency. But long before you reach that point, your cells may already be struggling. I've had patients tell me, my doctor said my labs were fine. And technically, they were. But fine doesn't mean ideal for your age, your medications, your stress level, your metabolic health. And speaking of medications, this part matters more than people realize. Many common prescriptions used in older adults can lower mineral levels over time. Diuretics can drain potassium and magnesium. Acid reducers can interfere with mineral absorption. Certain diabetes medications increase urinary loss of minerals. None of this means the medications are wrong, but it does mean the body may need additional support. This is why I get concerned when I hear blanket advice like, just cut the salt, or just walk more, or just lose weight. Those statements ignore the complexity of an aging system. Let's talk about diet for a moment. Not in terms of rules, but in terms of nourishment. As people age, they often eat less. Portions shrink. Meals get simpler. Sometimes it's appetite. Sometimes it's convenience. Sometimes it's fear of doing something wrong. But less food means fewer nutrients, and the first things to drop are minerals. Leafy greens, beans, nuts, seeds, whole foods. These are often reduced because they're seen as unnecessary or difficult. And yet, these foods are some of the richest sources of magnesium and potassium. Protein intake often drops too, especially in women. That affects zinc levels more than most people realize. And when zinc drops, inflammation rises, immunity weakens, and blood sugar control becomes more erratic. What worries me is how many seniors are told what not to eat, but almost never told what to prioritize eating. Now, I want to be very careful here. I am not saying everyone should run out and start taking supplements blindly. That can be just as harmful. Minerals interact with each other. Too much of one can block absorption of another. This is about awareness, testing when appropriate, and individualized guidance. But awareness alone is powerful. When people understand that rising blood sugar and blood pressure are not moral failures, not personal weaknesses, not simply old age, something shifts. Shame disappears. Curiosity replaces fear, and better decisions follow. I also want to address something emotional that doesn't get enough attention. Many seniors feel like their body is no longer trustworthy. They say things like, "I used to know how my body worked," or "I don't recognize myself anymore." That loss of confidence can be just as damaging as the numbers on a chart. Understanding mineral balance gives people a sense of control again. It reminds them that their body isn't broken. It's asking for support in a quieter language. And here's something hopeful I want you to hear clearly. The body does not forget how to respond. Even in your 70s, 80s, and beyond, cells can become more responsive when they are properly nourished. Blood vessels can relax more easily. Insulin can work more efficiently. Energy can return in small but meaningful ways. I've seen patients cry, not because everything became perfect, but because things finally stopped getting worse. That matters. So if there is one message I want you to take from this, it's this. Managing blood sugar and blood pressure is not just about fighting numbers. It's about rebuilding foundations. Ask your doctor about mineral levels. Ask about medication interactions. Ask whether your diet is nourishing you or just keeping you full. Ask whether normal is truly enough for where you are in life. Because aging is not a passive process. It's an active partnership between you and your body. And when you listen closely, really listen, you may find that the answers have been there all along, quietly waiting to be restored.